Hi, I'm Dr. Mitchell Roslin, the Chief of Bariatric and Metabolic Surgery at Lenox Hill Hospital in New York City, Northern Westchester Hospital in Mount Kisco, New York, and a professor of surgery at the Barbara and Donald Zucker School of Medicine, all part of Northwell Health. It's really, really frustrating for patients when they get told the surgery went well and they tell you, boy, doc, I'm really nauseous. And the major question is what causes the nausea? What can be done about it? And I think it's a complex answer. To begin early in the post-operative period, the most common reason people are nauseous is probably a reaction to pain medication and narcotics. So any patient that's taking narcotics, one of the side effects will be nausea. As a result, many of us have tried to limit narcotics for a lot of reasons, nausea being one of them, addiction being another, so that most patients don't go home from the hospital with opiate pain relief. The next issue that can occur is low volume states or low glucose states. So again, if you've been on diabetic medicines, your need for them is going to be different. And hydration is really, 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 really important in the first phase of bariatric surgery. When I started doing bariatric surgery almost 30 years ago, I guess it is 30 years now, we didn't even feed people for the first few days after surgery. So, again, I know we talk about the importance of protein and fiber and vitamins, but in the early post-operative period, hydration and being able to take at least 2 quarts of fluid a day are the most important thing. As you move away from the operation, rarely you will have patients that will complain of almost like a morning sickness type of feeling. They wake up extremely nauseous. Again, when that happens, it is very important to check the operation and make sure that there's no mechanical reason. And this is hard to do because bariatric surgery is different than everything else in surgery. In most things, we remove diseased parts or we fix diseased parts. In bariatric surgery, we make a controlled abnormality. So we want to make sure that there's no blockage that's affecting hydration or affecting or impacting on why you can't eat enough foods. And it's a vicious cycle because if you don't eat and drink, you get nauseous, but if you're nauseous, you don't eat and drink. Once that checks out, it's treated by using anti-nausea medications, potentially things like Zofran. But again, the most important thing to do is concentrate on your hydration and getting the right foods in. So meeting with your dietitian, using a diet that's similar to what babies use after formula. Some of the tricks that I use is I ask people to drink tea and honey. Sometimes when that doesn't work, I go to foods that will melt in their mouth. One of my favorites is an Israeli snack called bamba. Not the healthiest because it's still processed, but it's a peanut snack that kind of disintegrates in your mouth, so it has some degree of protein in it. It also has a little bit of salt in it. And again, rules, make sure there's not a mechanical cause. Make sure you're getting a source of vitamin down, especially thiamine, so that you don't become thiamine deficient. That's really the most important vitamin in the early post-operative period because we mostly have stores for most of the other vitamins, but thiamine stores we can lose in about 7 days, and we don't want that to happen. Try to stay as hydrated as possible. You can use medications, whether it's Reglan and Zofran, to help. And another thing that sometimes happens is if you withdraw something abruptly. And this is why I think it's phased in. So for example, people that used marijuana regularly and then they stop right after surgery there can be a rebound of the endocannabinoid receptor, or people who are extremely caffeine dependent, and we tell people to avoid that. So again, a good history makes sure that there's nothing that you kind of have become somewhat dependent on that's been taken away from you. There's no one step. The good news is, as long as there's no mechanical issue, this usually improves in several weeks or at most 3 months. But again, it requires, one advice I can say is it doesn't necessarily mean that the doctor did anything wrong, and you should work together as a team to solve the problem rather than being very, very, very upset, because sometimes this happens even if the operation is absolutely perfect. I'm Dr. Mitchell Roslin. If you enjoyed this video and found it helpful, please subscribe to our YouTube channel.